Hello, good afternoon, everybody. This is Dominic Zerlo with the New Mexico Department of Health, and the chair for this meeting, DezBaa, is actually going to be joining here in just a few moments. She is running into just a little bit of issues logging in, so we're working in getting that resolved. In the meantime, what I will just wanted to go over is that this meeting is for the Medical Psilocybin Program, the Equity, Access, and Cultural Considerations Committee. And the chair of it is DezBaa. And again, she'll be joining us here in just a moment. My understanding is how she has been working and running these meetings. This particular meeting is as more of a listening session because she wants to hear, and we want to hear from people who have concerns, comments, constructive ideas, and different things with regard to the medical psilocybin, and especially with regard to access, equity, and other cultural considerations. This meeting is being recorded, and once the meeting has concluded, it does take us a few business days to get these up on our website, but they will be put onto our website. If you have questions about other committees, for example, if you have not been able to join those other meetings that have occurred, the same is true for those. What we do ask again is it can take a few business days for those meetings and those recordings of those meetings to be up on the website, but they are and they will be available usually within about 5 business days. Sometimes it takes a little bit longer. Please just be patient. Our IT team at the Department of Health does their best to be able to get those up there, but it does sometimes take a little bit of time. And with that in mind, we do have a few, or for this meeting, when individuals are getting ready to speak, when we're ready to ask for that, we'll ask people to raise their hands. And then once individuals have raised their hands, what we will go ahead and do is we will call on order for those individuals, and then you will be able to speak at that time. When we do call on you, we will have unmuted you from our end, but you will need to unmute yourself on your end. And I will be putting up instructions here in just a moment on how to do that. But essentially, it is to raise your hand, just go to the upper portion of the Teams window, and there is a little hand icon there that says raise, and then you can go ahead and actually raise your hand. And then as far as to speak, once we unmute you, then you will be able to, at that point, you will be able to unmute your line. And the way you do that is just click on the mic button. Please make sure that your microphone is a microphone that is working. Sometimes we have had where people have had headphones that are connected but are in another room or in another area, and so they have not been able to speak at that point. However, just check on that aspect. And then with regard to if you're on a phone, we'll put that information on up. And I do see in the chat that there is someone who said they cannot hear. Are there other individuals who can? If one or two people can just put in the chat, can you hear us? Or that way we can look and see if it is just for that one individual or other people. Oh, here we go. Okay, great. Thank you, James and Robert. Thank you very much. I appreciate it. No one else, other people don't need to say they can hear. We'll get that here in just a moment. So thank you very much. I appreciate that. Actually tells me everybody is being not only can hear, but very responsive. So we thank you for that. For a few people who were a little bit late in joining on in, DezBaa is joining us. She is working on getting everything set on up. And so will be joining us here shortly in just a moment. In the meantime, again, what we're just talking about is the fact that this is really more of a listening session, and that once we are able to start with regard to public comment and to hear from people, what we will go ahead and do is we will open it up, have people raise their hands, and then from that point, we will unmute you on our end. You'll just have to unmute yourself on your end, and then you'll be able to speak. And with that, DezBaa, have you, oh, give me just a moment.
Hi, sorry for the technical
There we go.
difficulties.
You are there,
Okay,
DezBot, and we can hear you now. So
all
that
right.
is perfect. I did, just so you're aware, I did an introduction that this is as a listening session and how people can actually hear. So if you'd like to introduce yourself and your thoughts, ideas, and then it is your meeting.
All right, thank you. Yat Shida DezBaa. Thank you all for being here. Sorry for the delay. Technology is not my friend right now. So anyways, thank you, Dominic, for doing the introductions. For I'm both on my computer and on my phone. That's the way it is right now. So that's why you're seeing my name double, and it's good to see a bunch of James, I see that you're here. Any Brett, I also see that you're here as well. Let's see some other people, some new people. Marlena here, Richard. Let's see, Mary. Okay, awesome. Denali, great. So this is basically what I had wanted to just get like more people involved in understanding like what are the concerns for this specific committee for equity, access, and cultural considerations. It is a huge, broad kind of topic. And so, um, I guess just as many people who might have something and dying to say something, please do. Initially, what I had, I don't think that the video and the minutes have been posted just yet from the last session. But basically, what I consider as far as I have an obligation as the Native American component of the advisory board is to ensure that we do have access to that cultural um, a contribution. So we are going to be doing, I am, all of us, with your contacts, with all the hard work that everyone has been doing, really trying to get that input as to what, the tribes may or may need. It's complicated. There's federal regulations, New Mexico state, tribal sovereignty. It's a really huge converging confluence of all of these governance, and what does that look like. But not only that, broadly, in indigenous ancestral wisdom to me is something that has been here prior to even human existence. That is where we're kind of meeting the mushroom essentially. And what does that look like? And I feel that, as at least for my part, that's not something that is necessarily I'm lifting indigenous wisdom and ancestral wisdom on my own, that it is actually up to all of us in the board and as a community to really kind of make sure that we are listening to the medicine in the sense of how we going to bring back the what governance is when it comes to regulation, when it comes to safety, when it comes to frameworks. We are only looking at psilocybin. We are not looking at other types of psychedelic medicine, but that is, something that might be in the back of our mind and something that at very close to our heart, especially when we're talking about plant medicine and ancestral wisdom. This is a short session, and again, I apologize for the fact that it was technical difficulties on my part. But if there's anybody who is already dying to speak, please do so. Very, very, very you don't have to really do too much of an introduction. We are going to understand that there are agendas as far as like where your platform is, where you are at. We are going to be looking at people or listening to people who are from outside of New Mexico, outside other organizations, but we are strictly also looking at how this affects New Mexican citizens and those that live, work, and cultivate here. So there's any other questions for me specifically, go ahead, but I would actually just really like if there's anyone who has a specific concern that they wanted to bring up and bring to the forefront. We'll kind of keep it to about 3 minutes, maybe. It's just like kind of short and sweet. I think I see, who is it?
So we have
Shane.
Shane there.
Shane
Let's start with
first?
him.
Yeah.
Shane, I have unmuted you, so you just have to manually go up there and
Yep.
press
Can you
unmute
hear
to
me?
speak.
Can you hear me?
Yes, we can.
Yes.
Okay. So just off the top of my head, how are we defining the equity portion of this, as far as, or because equity seems to be a word that has, I'm an older guy, so over the last 10 years, the definition has changed somewhat, it seems like. So I want to understand how you're defining equity here.
Okay. Equity is just being able that across, as far as I understand it, is just across the board. It's not necessary. It could be geographical locations. That's another thing that we're looking at. In the last session, we were looking at telehealth and how that might be implemented in providing that equity. There's rural locations. I grew up in northern New Mexico. There are people who have interest, for providing to people in Mora or other rural communities. It could be financial, in terms of financial, cultural, but being able to provide, uh, and those are the things that we are going to look at. What are those definitions specifically? We might be borrowing language from other places, from other parts of the department or other things that are in place. So those can be implemented into it, but that's part of what we're looking at, is what is going to define that. So that is a good question. What is that going to look like? And that's kind of where we're coming in. If there's something already in place, we might use that as a definition. Broadly, it could be, what is it that looks like for New Mexicans at this point. Someone did like a financial, what is the poverty line right now. Someone redid this and found out it's not just food, shelter, and I can't remember what the third one is anymore. The cost of living is no longer, $50,000. It's like $132,000 nationwide. That's the poverty line because of health insurance, because of all these other things that we have to pay for. So that is a good question. What is that? What is it really going to be defined?
Right, because talking about and doing some research. I've done a lot of research. I've researched Oregon and Colorado on this, and they've got it wrong there. It's way too expensive for the patient, or the person that's seeking healing. And I would like to see New Mexico get that part right and not make this a money grab. Yes, money has to be made, right? I understand capitalism, but when it becomes too expensive for the people that need it the most, which we've got two very heavily hit communities by opiate addictions, and maybe more. I know of two that they talk about nationally quite a bit, and that's Espanola and Taos. If it's $5,000-$10,000 to get a treatment, or that's too expensive. $1,000 is too expensive, right? For some of these people that are at the end of their rope, and definitely if they had $1,000, they wouldn't be. Well, let's just put it this way. I have a lot of history with drug addiction, and most drug addicts won't be able to come up with $1,000 to get treatment. We need to figure out a way that, because insurance probably is not going to pay for this for a long time. We'll see what happens there, but we've got to get this working at a affordable level for the people that need it the most. And I'm probably over my 3 minutes, so I'll give it back to you.
Thank you. Appreciate. Yes. Saw someone else who had a hand up, but then
we have another question a hand raised by Dan. Dan, I have allowed your mic. If you could please unmute yourself and begin to speak.
Hello. Wanted to say thank you for allowing me to be here. And I am Daniel Hewson from Portland, Oregon. I own Rose City Laboratories, the first and only licensed laboratory in the state. I agree with that last person that Oregon and Colorado have some things wrong. It's not affordable, and I don't mind sharing, but we're an environmental laboratory and a cannabis laboratory also, which is the only reason that I'm able to afford to be able to test for the psilocybin industry. I do it because it's a passion of mine, and I'm here because I hope and pray that other people, other states will listen and try to do it right and better. I believe that probably you guys should try to keep any outside companies outside, including, and this isn't going to be popular, but even including training facilities, schools. Keep that all in your state. There's been so many things going wrong. Back in July, I checked my books just to see how much money I had made for testing for the psilocybin industry. And it's constantly going down because people don't need continuing treatments, and people are doing larger batches. So back in July, I had only done like $11,000 in sales and for that industry. And out of that 11,000, I have to pay $10,000 for a renewal license, which is way too much. So I had to raise my prices 90%. Everybody's going to still pay it and everybody's going to still do it. But at the end of December, I had done $25,000 in sales. A company can't survive on that. It has to be affordable. You have to keep companies in New Mexico, allow them to do it. Don't allow outside companies to come in. Limit the number of training facilities, because honestly, you're going to run into a brick wall where you're going to have so many people trained because everybody's excited, but yet there's not going to be enough work for everybody. So not everybody's going to be able to renew their license. I just really would like to see, Oregon and Colorado allow people, we talk about equity, we talk about indigenous here in Oregon, but yet I don't see them being serviced. You can't go to a tribal property or facility and do it because there's no facilities there. You should be allowed to, do it in homes for people that are dying. And a lot of that's going to reduce a lot of the overhead and the costs by allowing the freedom. Sorry, I'm probably over my limit. I'll shut up. If you guys have any questions, I'll stay on, but it's tough here and the industry here is collapsing. Just thought I'd let you guys know. Thank you.
Appreciate it, Dan. And before you decide to go off, we do have other committees, and then I'm sure that anybody else who is not here would be interested in even hearing your input, your what you have to say. We have of end of life care. Also, for anyone else who's listening, end of life care is coming up, I think, tomorrow at 3 p.m. We have propagation committees. Training and education is further on at the end of the month. So keep a lookout for the Department of Health. And at least I speak for myself, and I know that we do need this input from other people, and we do need to have more of a conversation and a discussion. And we're looking for this input. We're looking for what you have to say about what's not working and what has worked, because we do want to get it more right as we proceed in this. And we have such a responsibility to not also just our citizens here in New Mexico, but for the whole of, of humanity. I really feel to to be Santa Fe woo woo, we have a responsibility to the whole of humanity to work to try to meet what the medicine wants us to do as a community, as a governance. And so I appreciate your insight. Thank you.
You're welcome.
Who else
So
do
we
we
have
have?
Lisa Ginsburg. I have allowed your mic. You may now unmute and begin to speak.
Hello, hi everyone. Thank you so much for your time and for all your work putting this together. I appreciate the notes that have been shared previously with other speakers. I personally believe in an open market, and equity means access to everyone. And I believe that restricting this access only for the citizens would limit tremendously the opportunity to learn from the best minds, from research centers, from John Hopkins, NYU, because a lot of training programs bring a wealth of knowledge that already exists. I also think that opening access will drive prices down. Um, we see a big slowdown in Oregon. Colorado is still trying to understand what's happening there. And I think that's natural for new emerging industries. However, opening access will create more opportunities. And I also really happy to see that New Mexico is launching a medical model that would allow practitioners, medical practitioners, provide these medicines to um, the patients, the clients, which is very different from Oregon and Colorado. For that, I definitely believe that these practitioners should have access to the best education possible that might not exist currently in New Mexico. Um, and of course, the more practitioners we have licensed, especially practitioners, partially why we see the slowdown in Colorado and Oregon is because it's a recreational model. So a lot of people entering this system for the wrong reasons. People with very poor education coming in thinking they're going to make a lot of money providing psilocybin to their clients. It's not the case. If we allow licensed therapists provide this to their clients, they already have database of clients, they already know what they're doing. So for one, they can provide better services. For two, the more trained practitioners we have, nurses, therapists, doctors, the better it is for the clients. So I believe we should create accessible program that can potentially drive prices down, but the only way to drive prices down is by creating more practitioners. So thank you so much. I appreciate your work, and that's all I want to say.
Thank you. All right. Is there anybody else who wanted to say? James? I think James.
Hi, can you guys hear me?
Mhm.
Wonderful. My name is James and I'm from Arizona. It's a pleasure to be with you all, and thank you, DezBaa, for hosting this meeting. My curiosity lie with Native American tribal leaders and practitioners that utilize peyote in their ceremony. And I think it's invaluable wisdom to look to them because they truly understand set and setting amongst indigenous I should say, experiences. And so I think it would be really good for this committee to look to tribal leaders and obtain kind of their perspectives, because I think it is something that is going to be really implementable, especially with the 219 bill. So thank you very much for listening and understanding.
Thank you, James. There anyone else who wants to chime in here? No? No? Okay. Yeah, so from the people that have spoken up, what I'm looking at too is I know that listening isn't so much like getting down to business, and I totally understand that. And it's just like a small group. It will be more formalized in the coming meetings that we do have, figuring out like what is the actual structure, trying to get through a lot of this. And part of like why it's just kind of listening, I just wanted to hear like who's kind of out there actually listening in on what's going on here. It's kind of hoping to get flooded with a lot of people wanting to kind of chime in and give their input. But as far as like tribal, like I had mentioned before, um, at least in my understanding, that there are grassroots organizations and networks that are trying to reach out and do education outreach when it comes to getting into the Pueblos, especially here, it's mostly Pueblos. And then there's a patch in the Navajo Nation. It gets a little bit trickier, I think, when it comes to specifically like Navajo, which crosses 3 different states. And so to me, trying to make sure that understand like what does tribal governance look like when we're talking about New Mexico state, and then also with any federal regulations and or treaties that are already in place, such as taking care of the Native Americans through IHS and so forth. But really understanding how those what we're trying to do here bridges into that. I know we have a tribal liaison with the Department of Health already in place, and then also different tribal health practitioners. So Dominic, did you have your hand up?
Yeah, DezBaa, I just one thing I wanted to add in is because you did mention about our tribal liaison here at DOH, and one of the
Mhm.
things that we've been speaking with them regarding is setting up a meeting specifically for the Native American tribes, pueblos, and nations, so that to be a safe and inviting place for individuals from those communities to be able to come and express and to be able to do so in a much more involved way, hopefully. And so we're working on that. The one issue we, of course, have run into, as many people on this call know, is that it's difficult to arrange during the legislative session, which starts very shortly. And so we're trying to see when and where we can do that. Once it is set up, it will be, once the meeting has completed, we will have information about that, but it will be an invitation to the tribes, pueblos, and nations to be able to participate and join in and ensure that we're hearing from as many different communities and people as possible. So just wanted to make sure people know about that. We've been talking about it for a bit, but it unfortunately, just with as many different pieces as are involved, it takes a little while to get set up.
Yes, exactly. That's a good point to make, Dominic, because for anyone who is listening and is not very aware, and I'm also learning this as well, at this time of year, just yesterday, a lot of the pueblos did go through the ceremonies of, I guess, installing or the changing of the colors for the different tribes' governors. So it was King's Days yesterday, so they did a lot of ceremonies like in Taos and Santo Domingo, and that's when then they change every year. So that's another, added challenge of, getting everyone on the same page. So it's not as if things are not happening for anyone who's like really, really excited and worried and, what about the tribes? It's just tribal governance. It's not just necessarily all what it's to the best of what we can do. And so all the pueblos are changing every year. That's another thing. And so then also again, the Navajo Nation, completely different thing, 3 different states. What does that look like? So what I'm hoping for, and again, sorry, I jump around a lot, but is the flexibility of what that equity and access and cultural considerations actually really looks like, in sense of what is established within the regulations of New Mexico, that the access is friendly, as to what Dominic was saying, friendly, accessible, that there is education and outreach available to and for the liaisons, or however we implement this for the pueblos, should they choose as to be a part of their governance, right? That's one level. The other level, which is what I mentioned, is the grassroots level, where a lot of people are working on their own volition to reach out into and have that education, have that outreach. And so those are also the people that I feel like, because that's less governance, it's more personal. Let's just put it that way. That might be a way to marry the two, or at least have some kind of confluence with the effort, right? And I feel like that's what the access for. But kind of back to the first question, like what is equity? And I know that Lisa explained, it's for everyone. And I think that is true. The only reason why it's within the constraints of New Mexico is because borders. And of course, what does that look like? And, New Mexico is on the forefront of a lot of things. We've got we take care of our citizens to the best of our ability, I feel. And I feel when it comes to healthcare, and there are a lot of things that we're lacking, but I feel like this is definitely one of the ways in which we can, as a community of New Mexico, pull our own people up by supporting, wrapping around, and giving that support through access to this medicine. I think I see L. Byers, who has their hand up.
Yeah,
Yeah,
yeah, I've just
hi.
perfect.
Thank you. Hi, nice to meet everybody. My name is Elle. I'm a social worker. I'm based in New York City, but I'm originally from New Mexico. And something that comes up for me first and foremost when thinking about access and equity is education. Out here in my practice, I work primarily with BIPOC populations, and something that I notice is like a resistance to ancestral medicines. And I think that that's largely because of coloniality. And so education is, I think, a really important part of this conversation and a really big part of decolonial work as well, because we have to implement a lot of like unteaching the propaganda around these medicines for people to want to access them or feel safe accessing them. Um, and yeah, I think another point that someone else brought up when they were talking about like the recreational model versus the medical model. I think that that's a really strong point, especially because in Western society as it stands currently, um, and big pharma and its dominance, most people, especially marginalized communities, have access to treatment and to medicine through services like ERs. And so they're not necessarily in spaces or have access to spaces where it's like private clinical practice or groups. And so I think it's really important to like work through when we're talking about how to make access more possible for these communities. I think it's important to acknowledge what is like dominant and popular and accessible now and work through that angle, if that makes sense. I hope that all of those points make sense. I might not be as articulate as everybody else, but yeah, I just wanted to share those points.
No, thank you, Elle. Before we get to Meredith, just really quickly, when you were pointing out the recreational model versus the medical model, and then kind of undoing the colonial systems, I think that's really important. The thing that comes to mind is, at first they took away education from Native Americans, and we were forced to assimilate to, white colonial standards, right? And because we're stupid. And then now it's just like, well, we're fighting back based on the terms and the metrics that were imposed on us. We're getting degrees as lawyers and medical, et cetera, et cetera. So working through that model, I feel what you're saying is, what is the dominant thing here? And when it becomes something that's safe to use, um, through the medical. And that's kind of the thing that we're talking about. Some people are on the side of we need access to outdoors. This needs to be done in an environment that is, outside, et cetera. And then, but we have some people who would feel that's too much. And, we have to meet the person and the medicine, what it's calling for. Really personal, off the wall analogy. I can snorkel in the ocean. I'm fine. Put me in a pool, I can't do it for some reason. So I get what you're saying as far as use whatever it is that we have, the tools that are available to us, because not everybody is the same. And we really need to meet the person and provide the environment that is most conducive to a person's healing, regardless of where their background is. And then also with in mind the colonial systems that working and using the colonial systems to further our own people, which I feel is partially the reason why we have the governance in New Mexico regulations, if that also makes sense to anybody. Meredith.
Hi. I was curious as to whether or not there's been any conversations about people on probation and how to get them access to this medicine. And then maybe further down the line is like people who are currently incarcerated. We have a lot of the population, a large incarcerated population in New Mexico, and who might very much benefit from access to these medicines. So within this conversation of equity, kind of thinking about people who are often shunted to the sidelines of our communities, who would really, really benefit from the access. I was just curious if that's been in the conversation at all.
No, Meredith, so far you're the first person, and I feel like it would really work with the recidivism. Dominic, I think, has something to say on that.
Yeah, it hasn't come up in these meetings, but we've actually been exploring that. There are some issues with regard to the requirements of probation or parole. And then, of course, when individuals are incarcerated, including that they cannot be utilizing substances that are Schedule 1. And so those are some barriers that are going to need to be resolved. In just to kind of give an idea, those are some things that we have worked through previously with regard to cannabis, as an example. And so I actually have hope that we'll be able to do that, but that's a much longer process. It has been brought up again as far as discussions internally and about how do we reach those individuals, because we have a lot of programs at the Department of Health that work with incarcerated individuals, and we do want to make sure that we can access it. And as was just put in the chat, the current law does not prohibit it. It's really about, as far as for people who are on probation parole, it's really about the other requirements that there may be based upon other, with them being on probation and utilizing substances. So we have to work through those. And again, we're pretty confident that we'll be able to do that, but it may take some time.
Thank you, Dominic.
We have a question here from Dan, I believe, or is it Meredith again? Actually, I forgot to lower your hand. I apologize. Okay. Dan, you go ahead.
I just wanted to bring up, I wasn't sure if the health department there, everybody is aware that the DEA recently put out a memo asking for an increase in psilocybin production. So I just wanted to throw that out there. I think the federal government is going to be a lot more laxed moving forward.
I did not see that memo. It doesn't surprise me, though. Thank you. Denali?
We have another point. You may unmute. Go ahead.
Hi, everyone. Grateful to DezBaa for your leadership and the department for convening. My name is Denali. I am the Director of Strategic Support for the Healing Advocacy Fund, which is a nonprofit that supports psychedelic therapies and specifically the state-regulated access programs. I'm based in Las Cruces. Just a couple of things as this discussion rolls on. I am really grateful to hear energy and excitement about engaging people in custody, whether that's in prison or on probation and parole. And I appreciate Jeff's acknowledgement of the statutory protection. I'd say it goes farther than doesn't prohibit them from participating, but the statute actually protects people who are on probation and parole. So there's a section that says that people who are on probation and parole cannot but be penalized, whether that's violation of parole or anything else, for their participation in the therapeutic program. So I'm really grateful to the legislative leadership that made sure that that's a part of it. There's the statute and the protection. So grateful for that. A couple of things, and if I go too long, just interrupt me, DezBaa, or anyone else. But I know that it's a really important equity question early on for the department and for And for the advisory board is going to be developing the list of approved clinicians. I don't know that in the creation of the subcommittees that was specifically within the scope of any, and maybe that's best. It's best to be left to the full advisory board to make those recommendations to the Department of Health, but I think that that's an early important question for the advisory board to be considering, and of course want to see that list to be as expansive as possible, especially including peer support workers, community health workers that are already integrated into our healthcare continuum, and those services are already reimbursable and recognized under state Medicaid, also traditional healers. Let's see, I took a couple of other notes. Oh, there was some discussion too about insurance and this question of whether we're going to be able to, as a major barrier to access and equity. I think we're really lucky to be in New Mexico, where we have a healthcare authority that is our state Medicaid office that has demonstrated, a true commitment to finding a way to make this work. Of course, there's not going to be until and if there is FDA approval, there won't be a way for the state to cover the actual medicine, but there seems to be a lot of energy and creativity in thinking about the ways that that we can cover all of the other parts of the care model, which is most of the care model. On that, I think the way to make the money that so we have to commit to insurability and accessibility and supporting the healthcare authority to make sure that they have what they need to develop that coverage, and then be the model for commercial insurance to cover. And then, for the piece that is not minuscule, but a part of the care model that won't be able to be covered, that's where the equity fund that the bill created plays a really important role. I've mentioned this before, and I'll mention it again. I'm a little concerned that the funding of the equity fund that timeline wasn't pulled in when we pulled in the timeline for the program. And so if we are going to be moving towards a goal of seeing patients in December, we need also to have money to pay for that treatment. And I know it wasn't a part of the governor's budget. The Legislative Finance Committee released their budget today, and it also was not a part of that budget. That doesn't mean it's not going to happen, but it does mean we have to work to make it happen. And so I'm committed to that. I know there are others here who are, but just want to continue to be monitoring the funding of the equity fund so that we can actually pay for treatment when we set up the program. And I think that's it.
And Denali, so that last part when you're talking about, when you're saying that there was no money for the budget, like even just to get it, when we're talking equity, right? I guess to oversimplify it is that when we roll this out and we're like, okay, green light, that the potential is potential and not the hope is there is, but the potential is that the people who may need it most, let's say example is Espanola area, Chimayo area, et cetera, wherever, the people that are working with it are really hoping for this medicine to be able to help them. They might be the ones losing out because there's no money in the budget for them.
So yeah, I think so. So the SB 219 created. Yeah, can I respond? Okay. Mm-hmm. And then maybe Dominic, if you want to jump in. But SB 219 created an equity fund, which is to provide, whether that is a scholarship in total for treatment or partial funding, the eligibility is to be determined, and that's part of what DOH, with the help of the advisory board, I think will be doing over this next year. But there's not much decision to be made if the fund hasn't been funded. And so right now the fund is created by the law, but there's no money in the fund. So the legislature has to act to to actually put money into that fund so that it can be distributed to patients in need.
Yeah. Great. All right. Thank you for your input on that. I don't think there's anybody else who has their hand raised. And so I just want to, we're kind of closing in on the last little bit of time. Thank you all for, having the patience to listen and to speak. I know it's a little nerve wracking. Jeff, did you? And here's a couple of things. And then the future meetings for anybody else, whether it's to call me out on something that I've misspoke about, totally, I'm here to learn just as much. I want to acknowledge like all of the hard work that everybody has already done with all of that they're doing. Let's see. I'm going to read this out loud. Hi, this is from Senator Steinborn. We'll be working hard this session to get funding for the equity fund and definitely encourage you to contact your legislators to ask for their support. All right. So our New Mexico legislation is starting January 20th. We do have a social calendar that I am aware of that is being put up on their state website where they have the different days for different events that are happening. But, for anyone who does manage to make it up here to Santa Fe, it would be great to go say hi to the senators and tell them how important this is if you haven't already done so. And for the people who have already done this, this is really important. But also, too, I feel like, moving a little bit away from the governance portion of this and what we're trying to do in creating this framework is creating those opportunities to have these discussions with your family members if you haven't yet. I had to do kind of the same thing as well, that this is a lot of us are the people who are the cycle breakers. We are the ones who are saying that we are going to move in a different direction. We need to have more of that within our communities. And it's in as much as we're working to provide access to this medicine in a legal framework and a medical framework, not everyone needs to have the medicine, but don't forget that you, in your conversations with people, you are the medicine and it speaks through you for those of you who have had it, for those of you who have been changed and transformed through this medicine by the education, as was pointed out with Elle. The education is really important. And yes, according to Shane, this is also another opportunity to have, these networking with, your other like-minded individuals. This is something where we can all attack this problem of getting the medicine out from different aspects. And really, I just want to encourage everyone to continue listening to what needs to be said or also what needs to be shared as far as like the education. The thing that you fear the most, I feel, is the thing that needs to be done. And that to me is in any aspect of our lives, whether it's, I also work in the film industry, or whether it's, talking to my child and it's like, what is it that I'm going to share with them? And in that way, that is really honestly the work of the medicine and or you as the medicine, to educate and to share, to, as they say, integrate, right? The real work of the medicine is the integration part when it comes to working with other people. And if we're going to save this planet, what it really means, though, is that we're saving each other. And that's the community. And that's the conversations that we really need to be having with one another. And so I'll get off my soapbox here. But, we do have other committees, and we will be putting out more committee meetings as we get going with this. We do have another board meeting when we're all coming together to discuss the different issues we've discussed in the committees on January 16th. But there are other committees that are going to be working on, and you are all free to, don't overwhelm yourself, but free to kind of go and peek your head into those other committees as well. We have end-of-life care, research and continuous improvement. I know Dominic put the links up in the chat for you. Tell everybody, even if they're just curious, if they're just listening in and want to know what the discussion is, because it really does take a village, and it takes all of us to be able to understand what's going on here. Okay. All right. Yes. So because I hate to say this, but like yeah, I'll go back and forth between the fact that like this is work, state work, government work, but then also standing on my soapbox and being kind of preachy. But it's, I just feel like that we can all really just do a lot more good work with each other if we're listening, really listening to what needs to and I feel like that's what will help push the work through to get us as close to completing what we need to get done as a group, as a whole, in the next 11 months. So thank you all for your time. I appreciate it. Any other thoughts, please reach out on the psilocybin email link. You can address it to the committee that you're specifically having a question for. So for example, if it's equity, access, and cultural considerations, it could be EACC, subject line, trainings, facilities, whatever it is. That's the way to reach out to all of us as a group, as a whole, so we can have these discussions when we are in our committees or in the bigger board meetings. So it's medical.psilocybin@doh.nm.gov. So thank you for your time. Have a great night. I don't think I see anybody else with their hand up. No. Okay. Thank you for your time. I really appreciate it.
Thank you, everyone.
Thank you.